Hi, my name is Mary Corrigan and I'm talking to you today about alopecia areata and hair loss. If this is your first visit to my upload, welcome. And if you are watching this because you have already seen my first upload, welcome back. Just to recap, this was me 3 years ago. 4 weeks after these photos were taken, I was 90% bald. However, I went on to successfully regrow my hair, and I want to share this experience with you in a series of segments. Today I'm talking about your GP's doctor appointment. Some of you may have already been to the doctor and had either a positive or negative experience. Some of you may not have been to the doctor yet, but what I'm about to tell you is based on my experience at a GP surgery in Greater London and also the experiences of other women I have helped. I visited more than one GP at the surgery during my time while suffering from alopecia. Some were better than others, while one was outstanding in the support and advice given. The following are key points you need to remember when you go for your appointment. Firstly, in the UK, your doctor is known as a GP, and GP stands for General Practitioner. It's worth remembering that your GP will have a broad but not necessarily deep knowledge on a whole range of conditions, diseases and illnesses. Therefore, when you present with hair loss, particularly the small, smooth, round patches of alopecia areata, they will probably correctly diagnose the condition, but then your experience will vary depending on your GP. The most common response to the condition is that it's stress-related. On the first occasion of hearing this, you'll probably automatically be able to recount one or more reasons as to why you are stressed. At this stage, we are living in the modern world, and you'll be hard-pushed to find someone who is not stressed for one reason or another. Also, I've been to far greater stressful environments in the past and held on to my hair, so I was not convinced of this diagnosis in my case. I've got to say, when you hear it on your third or fourth appointment, when your hair is falling out by the handful and you're told again that you're stressed out, well, let me tell you, that tends to make you stressed out. It can be followed by advice such as relax, take a yoga class, and although in retrospect relaxation does help to reduce stress, personally I don't think it's going to cure hair loss. I believe stress can be a major contributory factor towards hair loss, but not the sole cause. If you are currently taking prescription medication, your GP should double check if hair loss is a possible side effect. Many medications, both prescription and over-the-counter, can list hair loss as a side effect, but people may not necessarily be aware of it. In the past, when my mother's hair started falling out, she discovered purely by chance that the over-the-counter hay fever medication she was taking was responsible. Further investigation, I found that hair loss tends to be a side effect associated with the non-drowsy varieties. Now that's not to say that everyone who takes these tablets are going to lose their hair, but if you are susceptible to your hair loss, obviously it's worth checking it out. Also, some statins medications are known to cause hair loss as a side effect. If, however, you are not taking any medications or your medication checks out okay, then you can request some blood tests. If you are lucky, your GP will order blood tests automatically. The most common tests they will test you for are your thyroid function, as discrepancies in the working of your thyroid gland can cause hair loss, whether it be overactive or underactive, although it's usually more commonly associated with underactive thyroid. They may also test for lupus, as hair loss is common whilst lupus is in its active phase. Women's hormone levels will be checked to see if you are going into the menopause, and a full blood count will test for anemia. Further conditions they may want to discuss with you could include the fungal infection, ringworm, diabetes, anorexia nervosa and bulimia. If all your GP's blood tests do check out okay, then you also should be asking to have your serum ferritin level checked. Serum ferritin measures the level of your iron stores. This is important because you may not be anemic, but your iron stores may be low enough to trigger hair loss. The problem with this test is that it has such a broad range as to what is normal. In a female, normal is considered anything between 12 to 150 nanograms per milliliter. Under 12 and you're likely to be heading into anemic territory. However, eminent trichologists suggest that levels below 80 nanograms per milliliter can cause hair loss. My first level was measured at 19. This was boosted to 37 after 3 months of taking iron tablets. If you fall into this category, your GP should prescribe you a course of iron tablets. Iron takes a long time to absorb, so you should allow 3 months before your serum ferritin levels are tested again. Iron is a very important subject area with women and hair loss, so I will address it in a separate upload because there is so much information you need if you are suffering from this form of hair loss. However, you are most at risk of suffering from low serum ferritin levels if you have recently delivered a baby, suffer from heavy menstrual cycles, have digestive problems which prevent your gut from absorbing sufficient iron, or if you've been dieting or exercising to excess over the past few months. It's also worth remembering that hair loss usually starts 3 months after the trigger point. So you may start losing your hair now, but you need to be thinking back at least 3 months. What were you doing then which could have triggered the start of the hair loss? Going back to iron tablets, please note it is important that you never ever take iron tablets without the advice or guidance of your GP. If you do not know what your iron levels are, you may unwittingly be suffering from a condition called hemochromatosis. This is when the body stores too much iron. If you take iron tablets while suffering from this condition, it can result in very serious, if not fatal, health consequences, so please do check with your doctor first. You may also wish to check with your GP that you can take the following dietary supplements. I researched what nutrients are required to sustain healthy hair growth and came up with the following list: L-lysine, magnesium, zinc, selenium, vitamins B6 and B12 and vitamin C. Once again, I will do another upload just on supplements, but suffice it to say that after taking them for 3 months during my hair loss misery, they sustained healthy hair growth to a point where I stopped taking them. However, 3 months later, once again that magical 3 months, my hair started falling out again, so I knew that supplements alone were not sufficient to maintain my hair. If you have already been receiving treatment for alopecia areata or diffuse hair loss or any other form of hair loss, your GP may well refer you to a dermatologist. This appointment can take weeks, if not months, to come through, and once again, do not expect to be handed a definitive solution to your hair loss at this appointment. My dermatologist agreed with me and my thoughts on low iron levels. When I went back for an emergency appointment after losing 90% of my hair over a few weeks, I was prescribed steroid cream, and for me this was of no help whatsoever. If you are suffering alopecia or hair loss of 50% or more over a sustained period of time, in the UK you may be entitled to a wig on the NHS. However, the prescription must come from a dermatologist, and as far as I know, you may also be means tested to assess your ability to contribute towards the cost. I personally never went down this route due to the colour of my hair. I would have felt conspicuous in a wig and felt that people knew I was wearing a wig, so instead I chose to use scarves, hats and baseball caps to cover my hair loss. However, if you do want to further investigate NHS wigs, go back to your GP and they should be able to advise you. You may possibly also be diagnosed as suffering from depression due to your hair loss. Your GP may well want to prescribe medication for you to counteract this. Once again, do ask your GP to double check for potential hair loss side effects, as drugs in this category do sometimes cause hair loss as a side effect. Finally, if you are not dealing with an empathetic doctor, do try to see another GP in your practice if possible. Some people I've known have even changed surgeries. It makes such a difference if your GP can feel your pain with you. I should know, I spoke to 3 earlier GPs before I finally saw one who was absolutely brilliant in her support. I hope this has been of some use for you. If you would like further information, please go to my website, www.whatsupwithmyhair.com. In the new year, I will be publishing a book with loads more information, but in the meantime, do please check back to see future uploads that I will be making. Thank you.